Thank you, Mrs. Chairman, dear colleagues, friends. Good morning. I'm very glad to be here. I'm in fact enjoying this marvelous city, Rio de Janeiro, and I'm grateful for the invitation to be able to share with you what are my thoughts and deliberations about the role of innovation and HTAI for health system sustainability. Hope I will know what is working. How is working? Okay. The outline for today's presentation will be the following. I will start with a premise, only one, but with some deliberated questions that in fact I made to myself when preparing this session for today, this presentation, and I thought it was fair to start by sharing with you. Then I will describe, of course from observation, what are the elements that make pressure to health systems. Of course I will then be a bit more deeply on the role of innovation and the HTAI challenges by showing, sharing with you what are some hints, in my opinion, toward a new health system and sustainable model. I will finish with a final reflection. My premise, if it is work, yes. My premise is that I will be using the term health systems in a very inclusive way. I mean, I will include health policymakers, providers, but also industry. So it's important to be clear from the very beginning. About the questions I was wondering is what sustainability means and for whom, because probably it means differently for policymakers, even for providers, patients, and industry. And what criteria we should weight sustainability? With criteria we have to weight sustainability? Only economic criteria? Only accessibility? Are we talking about accessibility? Or what is the ethical debate on all of this? Are we talking only on the most prevalent versus rare disease? Of course, I have no answers to these questions, at least to all these questions, but I hope that my presentation will contribute to a debate of all these issues after all. Before going, if the machine allows me going, okay. Sorry, it's not working very well. Should I? Okay. Well, I was saying that before entering in describing the elements that conform pressures for health systems, I would like to look a little bit for the evolution of healthcare over time. I'm very proud about this slide because, in fact, I summarize 100 years of healthcare in just one slide. So let me just share with you. You remember that the term patient, in fact, was coined before the 20th century because the meaning of the patients means who suffer, those who suffer. In fact, people were suffering because healthcare system was very ineffective, in fact, and they only provide spiritual care and not curative. The shift from spiritual care to medical cure, in fact, starts when it was understood the sepsia and antisepsia phenomenon. It was in oh my gosh, sorry. Okay. It was in the 50s when, and after the Second World War, that with the advances on surgery, blood transfusion, and the understanding of the diseases, like more infections, hospitals became like temples of technology. This is a picture of a hospital in Barcelona, the San Pau Hospital, which was built by Gaudí, and it looks like a temple, in fact. In the 1780s, WHO sent a message to all the world saying health for all. Probably it was understood as that having technology for all was good to have. But soon after, in the 19th, policymakers in health systems that couldn't afford such a spread of technology coined another term, cost containment for all. And my hypothesis for today's presentation, I think, I don't know, it's too slow, that maybe we are entering in the era of new models for trust and cooperation. I'm wondering this, and in fact, I hope that at the end of my presentation, maybe you can agree with me. Let's go to the health systems under pressure, but I'm pressured here, and it's not conscious. Yes? Okay, thank you very much. Very good. Now, we are totally agreed that healthcare providers and policymakers are under pressure. Andrew was mentioning that, of course, there are increasing expectations for and demands for healthcare. There are socio-demographic changes that were mentioning already, changes in the patterns of disease and risk factors, changes in scientific knowledge, very quick and rapid change in scientific knowledge, but also the globalization of health systems is there and put pressure in the system, since everyone can see each other, every country can look to other system, and this visibility is a source of pressure also. There are pressures for financial sustainability and pressures for patients' participation, transparency, accountability, and the spreading awareness of the need of evidence-based decision-making. But health industries are under pressure also. In fact, there is an increased scientific scrutiny of innovations. There are pricing pressures, generic and biosimilar threats, unsustainable R&D models, and also, you will agree with me that it's kind of eroded confidence or trust from society to industries. There are patent losses, uncertain pipelines, obsolete commercial models, and inflexible cost and organizational structures. In this context, how technology assessment is seen? Well, it's seen differently for healthcare providers and policymakers. HTAI is seen as a way to scrutinize innovation by reviewing the literature, analyzing the quality of this literature, and using all this information to balance whether the benefits worthwhile in relation to their cost. And at the end, these are the tools for decision makers to understand what are the paths or different alternatives for decision making. But what is the meaning for industry? HTAI is seen as a hurdle, barriers to overcome, that someone can jump with more elegantly than others, but at the end sometimes is seen as a way to save money or to cut cost. But innovation is here. The trends in innovation are so amazing. We are starting to understand that we are not anymore, the physiopathological models, all models are not anymore, valid. We understand by molecular biology that human beings are complex systems biology, and the genetic, environmental complexity and variability within human populations are an issue. So cell, gene and enzyme therapies are in fact open new doors for practicing medicine and even providing health care. This is all in all led us to a way of a new paradigm on health science research and healthcare provision. What are the challenges for HTA in this environment? Of course, everything is changing, everything is adapting. There are new knowledge, new ways to understand biology. Probably we will need new methodological developments, but we also will need more ethical debate on this and real involvement of all stakeholders. All means all. Maybe we can benefit from meta-networks. We can work and we can learn from other type of networks from other sectors, and we can enrich the evolution of the HTA. The dialogue that now I think is more than dialogue of regulatory people and HTA, this interaction is a very good message to industries and technological developments in order to understand how to do research. But also HTA has a role in submit to the same scrutiny that technologies, medicines, devices, to all healthcare interventions, services and public health programs. So, I'm convinced that we need a new and sustainable health system model, because the future is today, and in fact started yesterday. I like a sentence which is done by the CEO of a very famous industry that I think applies to all of us, to the public and the private sector, to the providers, health sector in general. Let me share with you some hints in what I think this new model of sustainable model should be based. And remember my premise, I'm talking about everyone. I think we have an urgent, very urgent need to broken the seal of thinking and behavior in both, in public and private sector. We need new organizational models that allow people to network. Because it's the only way I can imagine to put all the pieces in the puzzle for the sustainability in healthcare. But HTA have to understand that they have to do clear message, robust, consistent, in order to really understand what is the right way. I think the holistic approach, which is in the essence of all the HTA organizations, is the best one. The holistic that takes into account the whole thing, science, and policy, society, and development. I write a kind of cartoon, it's a caricature, in fact. This is the perception, the industry benefit growth, and then the cost-cutting from policymakers. This is not a sustainable model of relationship. I think we should go for other type of model of relationship, which is more stable cooperation, new ideas, new creativities, new models of organization. We need not only technological innovation, but organizational innovation, social innovation, and what I think HTA can help also is in understand what is obsolete and what can be the elements for disinvest in order to give room to the innovation that are really worthwhile for the society. Public-private partnership, I think, should be emphasized under the umbrella of corporate responsibility, clearly. But please, don't forget the solidarity, which always will be an issue in healthcare. So, my final reflection, if this machine allows me to reflect anything, is that in the area of networks, health system sustainability will mostly depend on the degree of healthcare stakeholders' co-responsibility. For the overall good, and to be able to build mutual trustiness, we need to assume that all of us are part of the healthcare systems, and each of us, maybe we have to lose something, because if we lose something, maybe we all win, at least in sustainability. Thank you very much for your attention.